I'm here today with Dr. Scott Turner, who's a plastic and cosmetic surgeon. He has a clinic in, he consults in DY, Leichardt and Newcastle. So thank you so much for taking the time to talk to us today.
Thanks for that. No.
Now just wondering, can you give us a rundown of the procedures and treatments that you provide at your surgery?
So our practice is fairly broad. We cover a lot of the general aesthetic areas. So our main areas are breast aesthetics. We do a lot of breast implants, breast lift with implants, breast anomalies such as tubeless breast and reductions. And also do the body contouring, so tummy tucks, liposuction, and also do an interest in labiaplasty. And then some general, aesthetics around the face.
Okay.
But the main focus is breast and body.
Okay. With the labiaplasty, I've heard that you've got a special technique.
So there is a few different techniques that have been evolved, I suppose, over the years from sort of wedge resections and deepithelialization techniques and just pure amputation. So we do more of a composite labiaplasty.
Okay.
Just find that it addresses all the areas of concern a little bit better and gives a much more natural shape. And the scar is sort of hidden more posterior, and so it's not visible, and it has a lower rate of dehiscence than a standard wedge technique.
Okay. Oh, great to know, because we get a lot of inquiry and it's hard to know, because the jury's out on, how safe it is, but...
No, it is. It is, I suppose, more of an area that women are becoming empowered about and becoming more topical, so people are asking about it.
Yeah.
I think people have been fearful about talking about it, before, and have been nervous and haven't really known who to actually seek treatment about. Most of the women we do, we get they're either younger girls that, in their late teens to early 20s that might have had moderate to severe asymmetries, or you get the ones post-pregnancies, in their 30s, 40s or 50s, had multiple pregnancies and then getting symptoms, of irritation and wearing clothing and exercising. And for us, it's a fairly simple technique, has a very low risk. They don't get any altered sensation. You have a very fine scar that heals extremely quickly. And within sort of 7 to 10 days, most people are back at work doing normal activities. And 3 to 4 weeks, they can go back to the gym and go for a run. And 6 weeks, pretty much
back to normal.
Back to normal.
Fantastic. Oh, that's great. Now, can you tell us what after-surgery care you provide for your patients and why it's such an important part of the process?
Yeah, I think, pre-operative assessment and making sure that people are fully informed about their procedure is extremely important. And so the post-operative care starts before the surgery. So we see everyone twice, a minimum of, a few weeks apart. So initially we see people and go through all the sort of, to try to address all their expectations and what they should expect after surgery. And that includes the good and the bad. And then give them time to go home and think about it and see them again, and then just reinforce those points so that when, there's nothing unexpected that really should come up for them. And it's important during follow-up that, we see people frequently. So we see most of our patients at least sort of 6 to 7 times in the first year. You see them fairly frequently initially after surgery, so around 1 week, around 3 or 4 weeks, around 3 months, 6 months, and then 12 months, just as a rough rule. Because, especially with things like breast implants or breast reduction, with scar maturing, things change, and people need to sort of be, guided along the way and see how we can sort of, make sure that their recovery is as optimal as possible. We see so many patients that have come in and had surgery elsewhere, and they might have seen a surgeon once or twice after their surgery, and then comes to 3 months and they're discharged from a clinic. Where for us, especially when we look at breast implants, we want to see patients for at least the first 10 years. Because things change. People put on weight, they lose weight, they have kids, their skin relaxes, the implants can move or,
Of course.
And we don't want to find a patient 5 years down the track and, they've had a complication for 3 or 4 years. We'd rather pick it up as we go along and make sure that they're fully informed. And
So it's not a matter of just having your breast implants, it's having them and getting checked all the time and follow up, make sure everything's okay and feel comfortable in the whole process.
And it's part of that education, even pre-op, getting patients to understand that, which is difficult because it's really difficult getting patients to come back. Because they get to 6 weeks and they feel great. They're, back swimming, exercise, training, doing that normal stuff. And it's really trying to educate them that, things will change. The way it looks now, that might be different in 2, 3, 5 years' time. And that we really want to be part of that journey and for them to come back and make sure that, that they're looked after as things change in their life.
Yeah.
They might have had kids, they might have been pregnant, they might have developed a complication like a capsular contracture. And that those things are addressed in a timely fashion. And even things now with implants, when you look at stuff like ALCL and, while it's extremely rare, that's
Good
why
to
we
know.
sort of following up, especially breast implant patients, to make
Yeah.
sure that these things are picked up in a timely fashion and we don't have, problems.
Yeah, the aftercare is so important. It's just such a major part. Okay, so actually that's probably one of the point of difference. So I was going to say, what is the point of difference about you and your clinic that patients are drawn to?
I think the biggest thing for us is honesty. We try to, we're not trying to be a flash clinic. We're not trying to be the plastic surgeon to the stars. We treat normal people. We treat mums. We understand that it takes a lot of time for them to, take a few weeks out of their life to have surgery, and they're often the husband or something. Someone else has got to look after their kids. So, and we're aware of that and how much that time that. It's a big thing for them to take that time out of their family life.
Yeah.
So we're honest with them. We're supportive of the process that they're going through and make sure that they're fully informed about costs of surgery, the amount of time they're going to need, the amount of support they're going to need after surgery, and seeing them, during that follow-up period that, that they're not just left. That we see them, several times in that first few months.
Yeah.
Give them advice and guidance and reassurance about how things are going.
That's great. That's so good because we get people all the time who've just been abandoned and left, so that's fantastic. You often perform many different procedures in your surgery, but is there a particular one that you prefer and why?
So we're quite passionate about aesthetic breast surgery just because the range of procedures that we offer. So breast aesthetics have changed dramatically over the last 10 to 20 years with the range of techniques we offer, including fat grafting now, surgical lifts. But we're particularly, we really enjoy doing sort of the breast anomalies. So tuberous breast, I think, is a particular, because these are women that have often had difficulty with, different shaped breasts, breasts, well out of the norm for many years, and then taken the leap to have surgery. And they're quite complex procedures, and they're not a simple breast augmentation. And unless they see someone that has a particular interest in it and can address the whole, the whole range of deformities that can be involved in that symptom, then they don't get an ideal result. So it's not as simple as just putting an implant in. It's a complex procedure. It involves modifying the gland, often adding volume with fat, using shaped implants and surgical lifts. And there's a lot of settling that goes on along with that.
Okay. And is there anything that you think patients overlook in their planning for their plastic surgery procedures?
I think the biggest thing they overlook is the length of time for recovery. I think people expect that they're just going to have surgery and bounce back super quick, but trying to educate patients that they're having a surgical procedure, especially things like tummy tucks, if you're repairing the muscle. If someone was having abdominal surgery and having their gallbladder out or their appendix out, people know they're going to be sore for 6 weeks and they're not going to be back to normal running around for a couple of months. But you get this expectation that if you're going to have a tummy tuck, then 2 weeks later you're going to be running around.
Great. So if you'd like to see, book in for a consult to see Dr. Turner, you can get in touch with him direct at the bottom link from this video, or you can email us at info@plasticsurgeryhub.com.au. Thank you so much.
Thank you.